Hello, and welcome to the Department of Surgery at Houston Methodist. I'm Dr. Osama Gaber. I'm the chair of the department. And I want to tell you that I'm quite thrilled that you're considering spending some of the best years of your life and your training years here at Houston Methodist.
Hello, I'm Sylvia Martinez, and I'm the program director for the General Surgery Residency program here at Houston Methodist Hospital. Our main teaching hospital is in the heart of the Texas Medical Center. Houston Methodist Hospital is a fully integrated healthcare, education, and research facility that has been named the #1 hospital in Texas for several years running. In the next few minutes, we will give you a glimpse of our hospital, our program, and most importantly, our residents.
So I'm originally from Worcester, Ohio.
Mexico City.
Leesville, Louisiana.
San Antonio, Texas.
Miami, Florida.
So I'm a native Houstonian. I grew up here.
My favorite thing about this city is that it really is a big city that feels like a small town.
The other thing is there's different things to do in Houston. You can go to Galveston, enjoy the beach.
Lots of food and lots of diversity, so.
I like a lot of outdoor things, and I like Houston because there's a lot of parks, and I just enjoy doing a variety of things.
The culture of our program is defined by genuine camaraderie among the residents, approachable and supportive faculty, and a level of diversity that mirrors the great city of Houston.
The culture and camaraderie of this program, I think, are one of its big strengths. Really from the top down, as far as the staff and the attendings go, everyone's very approachable.
All the residents, we all hang out together. We all are very good friends from chief level to intern level, and we all support each other, and I always feel like I can call a colleague if I need them.
We're always looking to help one another, so it's a really great family that we have here, and it's a great thing to be a part of.
I've never felt like I didn't belong. And I think that's the most important thing as an IMG. You want to feel like you belong.
You will find that we provide a robust operative experience incorporating the latest in surgical technology while providing unique opportunities for research.
I think that our thoracic surgery program here is very strong. We do a lot of robotic cases and we use a lot of high technology stuff, which I really like. I enjoy seeing.
The research that I did was very translational in nature, meaning that it could be easily applicable to the clinical setting.
They have given me essentially everything I could have ever have imagined and beyond. So during my second year, I was able to go to the American College of Surgeons and present. I was able to network with some very good faculty all across the world.
Our residents have graduated to some of the top fellowships in the country, and we've had a record of hiring our own residents back into our program because we know how well they're trained and how good they are.
You're being trained with some of the best in the field. These are the leaders, not just here at the hospital, but throughout the states.
The cases and the opportunities, you get such a wide variety that regardless of what you want to go into, you will have the knowledge and skills to go into that field.
We did everything from femoral popliteal bypasses to ruptured aneurysm repairs, open and endovascular.
And then you also get your complex cases, like Whipples and aortic reconstructions.
One thing that I really value at this program that a lot of programs don't support is the advancement in innovation and technology that's here at Houston Methodist Hospital.
I applied to Houston Methodist General Surgery because one of the faculty members gave a grand rounds at my medical school and talked about MIGHTY.
Our clinical resources are complemented by MIGHTY, the Methodist Institute for Technology, Innovation, and Education. Houston Methodist Hospital values resident wellness and has an active house staff council. As a department, we offer faculty to resident mentoring, and our residents have organized a peer-to-peer resident mentoring program as well.
I fell in love with the general surgery program here because of the strong female staff and older residents.
Our mission is very simple. We're dedicated to the best patient care, to producing some of the best surgical research, both in the laboratory and in the clinic, to educating the next generation of surgeons. We're dedicated to innovation and to linking up with our community.
I think that if you're interested in Houston Methodist, you should look at what Houston Methodist has to offer and see how you can tailor that for your career.
It's 5 years, it's very close-knit, so you want to make sure you fit in. We're looking for someone to fit in with our program just as much as looking for a good fit for you. And here at Houston Methodist, we have all the resources really to be able to provide that fit, and hopefully this can be a good home for you as well.
We appreciate you taking the time to get to know our program here at Houston Methodist Hospital.
And thank you so much for considering us for your training. It is a privilege, and we'll do our best to make sure that you graduate one of the best surgeons in this country.